So you're planning to expand your family and you want the best possible start for your little one, but did you know that preparation begins even before you get pregnant?
Was that yoga?
It increases the chances of conception.
In this video, we're going to dive into the essential actions to take before you start to try for a baby. From health checks to lifestyle adjustments, we're going to set the stage for a successful pregnancy journey. But before I start, let me know in the comments section if you are pregnant now or if you are starting to think about getting pregnant. And make sure to stick around to the end of this video because I'm going to give you a few tips on how to get pregnant faster. But before I begin, my name is Diana. I'm a certified physician assistant and a proud mom to 4 incredible kids. Thank you for watching Diana in the Pink. And now let's get started. So it's a good idea to schedule a pre-pregnancy checkup with your OB or midwife. They're gonna ask you a bunch of questions about things that could affect your pregnancy. They'll want to know about your diet, your lifestyle, birth control methods, past pregnancies, any medications that you take, and any diseases that run in your family or your partner's family. There are several important steps that you and your OB or nurse can take to make sure that your pregnancy is healthy. So it's best to do these things before you start trying to get pregnant if possible. First, let's talk about your medications and also herbal drugs. If you are taking any, it's important to ask your OB if they're safe to continue while you're pregnant or while you're trying to conceive, because some medications take a while to completely leave your system, so planning ahead is really important. Your doctor might suggest switching to different medications that are safer for the baby. They may also want to slowly reduce or taper your medications down because stopping medications suddenly could be harmful, especially for medications used to treat seizures, high blood pressure, lupus, or rheumatoid arthritis. Next, I want to talk about vaccines, and it's important to be up to date on your vaccinations if you want to get pregnant. Vaccines protect against diseases like measles, mumps, rubella, tetanus, diphtheria, polio, chickenpox, and possibly hepatitis. And even if you got these vaccinations as a kid, it's a good idea to make sure that you've had all the necessary vaccines updated. Getting sick with these diseases during pregnancy can cause problems for you or your baby. Also remember that the current guidelines are for you to get the COVID-19 vaccine when you're able to, and also remember your yearly flu shot. Taking a multivitamin with folic acid is another important step. If you're planning on getting pregnant, start taking a prenatal multivitamin every day and make sure that it contains at least 400 micrograms of folic acid, because folic acid helps prevent certain birth defects like spina bifida. You should begin taking the multivitamin at least a month before you start trying to conceive, because by the time you find out you're pregnant, your baby has already started forming important body parts that need folic acid and other vitamins to develop properly. Next, let's talk about your diet. Eating a balanced diet is really important with plenty of fruits and vegetables and also whole grains. During pregnancy, there are some foods that you should avoid. So raw or undercooked meat is a no-no. It's also best to avoid large fish that eat other fish like shark, swordfish, king mackerel, or tilefish, as they can all have high levels of mercury. Now, you don't have to stop drinking coffee, but you should limit your caffeine intake to 1 to 2 cups of coffee a day. And be careful to avoid germs in your food that could make you sick. Make sure to wash your hands and also your fruits and vegetables properly. Pregnant women should avoid deli meats, unpasteurized milk, unpasteurized cheese, and unpasteurized juice. Now let's talk about some habits. If you smoke or drink alcohol or take drugs that aren't prescribed by a healthcare provider, it's really important to just stop. Even a small amount of these substances can harm your baby, including e-cigarettes and marijuana. And quitting as soon as you find out you're pregnant isn't enough because your baby has already started developing and it can be affected by these substances. And if you need help quitting, please talk to your OB or midwife. They can provide you treatments to help you quit. It's also important to discuss any medical conditions that you have and the risks that they might pose during your pregnancy. Now, if you have just found out that you're pregnant and you have some concerns about what I just talked about, get that first appointment scheduled with your OB. But just know that most of the time, everything is still gonna be fine. But you just wanna make sure to make any modifications that you need to, and the sooner the better. Now, if you aren't pregnant yet and you are planning to try soon, as promised, here are a few tips to help you get pregnant faster. First, you'll want to know your fertility window. Your fertility window is the time frame each cycle where you can get pregnant. So to find your fertility window, you can either use an ovulation calculator, you can use an ovulation predictor kit. These kits test your hormone levels to help you know when you're probably ovulating, or you can try to track your ovulation symptoms. You can monitor changes in your basal body temperature and your cervical mucus to identify the ideal time for conception. conception. Now just note that if your periods are not regular, it might be more challenging to figure out when your fertility window is, so talk to your OB because they can help you to figure out when that time is. Now your fertility window includes the 3 to 5 days before you ovulate and then also the day of ovulation itself, so plan to have intercourse during that time. But if you're unsure of your exact fertility window, a good rule of thumb is just to have sex every other day during the middle 2 weeks of your cycle.
But it's a sacrifice I am willing to make.
Now, if you want a more in-depth video about the best ways to get pregnant, make sure that you subscribe to Diana in the Pink because I'm going to be doing a video about that coming up here soon. Also, for when you are pregnant, I have made an entire pregnancy series. I walk you through pregnancy week by week, going over pregnancy symptoms, how your baby is developing, what to expect at your next OB appointment, pretty much everything that you need to know about your pregnancy that week, I have a video for. So I am going to link to that pregnancy series right here. Click on that and I will see you over there.